Hey everyone, welcome back to my channel, and if you're new here, I'd love it if you would hit that subscribe button down below and turn on those bell notifications if you want to, so you don't miss a video from me. Today's video is going to be a bit random. You may be surprised, I don't know, some of you, but over the 2-month hiatus I took, and if you guys don't know what I'm talking about, that video will be linked down below because I made a video explaining about why I was gone. But over those past 2 months, I saw a plastic surgeon. I pre-recorded my consultation like I always do whenever I see a doctor and I want to document and put it on YouTube. But my doctor was so kind enough to give me permission to record in his office and record the whole consultation for you guys. I just wanted to make this an intro and talk to you guys first before we get into that and roll the clip. So as you can already tell by the title of this video, I'm interested in breast augmentation, but with fat transfer. The main reason, of course, why I want to get this procedure done is I got small boobies. I don't really have much to work with, and I've always wanted, you know, bigger, fuller breasts. I always felt like I was a negative A. It's really small for me, and I always thought I was gonna grow eventually as I grew up, but I never did. Hey guys, I just want to interrupt and come on here and show you guys exactly what I mean when it comes to my breast, give you a whole visual. I'm not gonna be topless for obvious reasons, but there are some ways that I can show you without being flagged on YouTube, of course. So I'm braless, I've got a crop top on. So this is like the front view. This is the side view. Yeah, it's really, really small. And you can see like the proportion between my arm and my chest. Like, yeah, my arm looks huge compared to my chest. So you can tell that it's super flat. It's really nothing. I got tissue, but I mean, if I wear a sports bra or anything, like it flattens my chest, and I'll show you exactly what I mean. Here we go. Sports bra on, I'm pretty much flat as a board. Yeah, pretty flat. Sucks. They never make bras my size, so. Okay, so this is the top I had on earlier. This is just with a push-up bra. I'm wearing a strapless push-up bra. I mentioned later in this video that I had problems with push-up bras because my boobs are so small and my boobs ended up slipping under every time I move around. So learned to get a smaller bra, like a smaller waist size. This is a 34A, so if I get like a 36, it wouldn't work. 36A, so it has to be the tightest, so that way it can like cinch into my ribs and hold my boobs up forever, for as long as I want. That way my boobs don't move, and whenever I lift my arm up, my boob won't slip under. So yeah, that's kind of my trick. And you can see from the side, the proportion between my boob and my arm is just, it doesn't look good. It's still really small. So yeah, but at least in the front, like, it looks filled, but this is literally all I've got. So, yep. Yeah, so even with a push-up bra, I still don't have cleavage. Yeah, maybe from the side a little bit, but I don't know. To me, it's just like a joke. I knew of breast augmentation with implants, of course, because I have family members that have it done or had it done, and of course social media and living in a society, you know, I knew plastic surgery was an option. But I didn't know about breast augmentation but with fat transfer until I was maybe 16. I remember I was watching a commercial with my mom one day of this plastic surgery commercial. This plastic surgeon was explaining that you can transfer your own fat into your breasts, and that's a procedure they can do. And I was like, oh my God, I want to do that when I'm older and I have money. Those of you that don't know what breast augmentation but with fat transfer is, it's basically harvesting fat from unwanted areas. Let's say your belly, your legs, your arms, any extra fat that you don't want, you can just transfer it. They'll transfer it into your breasts. I never wanted to go through the implant route because I obviously like natural breasts. Like, I like the look of natural breasts, like the feel of natural breasts. I love the little droopiness, and I love the way it looks when you push it up with a bra, with a push-up bra, and you have cleavage. But with implants, it's like, it literally looks like cantaloupes strapped to your chest. Like, it just doesn't look flattering to me. It looks so fake. Like, when they wear push-up bras, it's like, it just doesn't look real. It's like their melons are just gonna protrude out of their skin. And it looks disgusting. Sorry. I just never liked that. You can tell too if it's fake if the person like extends their arms out. Whenever they extend their arms out, their boobs, like their implants separate. So you can see that like distance. It's so unattractive to me. And also the rippling on the sides and on the insides of the bag is just, no. I just don't like knowing that anything is foreign in my body. Like, that's just not part of me. So the natural route is what I was always going for. And I always thought that if I didn't have it, then that's fine. Like, I much rather have my boobs than something fake. So when I knew about the whole breast augmentation but with fat transfer, I literally thought that whole procedure was made for me because it's all natural, it looks natural, you're using your own fat, nothing is foreign, and scars are really not that big of a problem because with the implants, they make incisions. I don't know, I think they make incisions like in the armpit and like slip the whole ball in. And they can do it around the areolas too, but with fat transfer, they're just using basically a syringe. So they're taking a syringe and sucking it out from one place and injecting it in the other. So you just get little tiny holes. Mind you, I did discover this at 16. That's when I found out about this whole procedure. So that's a huge gap because right now I'm 24. I just turned 24 last month. And between that time, you know, I was trying to get accustomed to my breast and find ways to accommodate it, like with bras, wear certain shirts and stuff like that. And I also, in between that time, did contact one of my family members, and my family members contacted their plastic surgeon that I usually go to, and they were saying that they don't do that procedure. I know several of my family members, and all their plastic surgeons that they went to, they said that they don't do fat transfer. So I just thought, you know, maybe not everybody really does this, so maybe I should just kind of give it up. Like, maybe it's not that popular of a procedure for a reason. So I just kind of, like I said, became accustomed to my breasts and figured out how I should, you know, embrace it. And there are a couple things that I do that I think that are flattering, things that I wear. I think I'll make a video on that. But I did complain a lot growing up because you look at social media, look at everybody who has bigger breasts. Some of them are fake. Sometimes I can't tell if they're fake, but some of them are really, really obvious. But anyways, people have bigger breasts, and so it just kind of makes you like think like, oh gosh, like I want to be on that train too. Like, I want to have bigger breasts. Like, it looks so good. It never made me insecure. I don't really like to use that word when it comes to my breast. I like to use that word when it comes to my acne. That is the one thing. My skin is the #1 thing. Actually, it's the only thing that I've been insecure about my whole life, it feels like. It's not my whole life, but 15 years. Acne is a huge insecurity for me. I like to use the word insecure when I'm completely embarrassed. Insecurity for me means embarrassment. I was never embarrassed by my breasts. I know there are some people that were teased and bullied because of their breasts. I never was. I never even was bullied for my acne. That's just lucky. I'm not here to boast, but that's facts. So my breasts weren't really much of an insecurity. It was more just a desire to have fuller breasts. I really had smaller breasts and I complained mainly because, you know, I look at other people and they're wearing push-up bras, and you want to try to make your boobs, give them an illusion that your boobs look bigger, right? So the first thing you turn to is push-up bras. Whenever I pick out a bra, it's just never fits me. Like I said in the beginning of this video, I always thought that I had like a negative A. Because whenever I wear a bra, even if it's a push-up bra, like I'll reach my arm out, and because my breasts are so small, like my boobs will slip under the wire when I lift my arm up, and then I have to go to a corner where nobody can see me and like readjust it, and it was so uncomfortable. So I can never find bras that fit me. I always felt like they needed to be smaller because it just, yeah, they never fit me. I always felt like I needed negative A bra. Like I need something to fit me perfectly, because, you know, when you can tell when a bra doesn't fit you too is when like there's a gapping. Oh, that is so annoying. Like the gap between your chest and the bra. Oh, it wasn't until a couple months ago my mom found this plastic surgeon on the island. His name is Dr. Ivy. You'll see him in the video. I'll link his Instagram down below if you guys want to contact him and schedule a free consultation with him. If you are on Maui, if you live on Maui. If you live anywhere else, don't even bother. Unless you want to fly over and you really want to see him. Props to you guys. My mom basically reinstated the idea inside my brain that I can do this whole procedure, because he said he could do this whole procedure, and I got excited. So this is what this free consultation was. That's what I pre-recorded. That's what you guys are going to see. I wanted to record this for you guys, for those that are interested in the whole procedure and want to know more and are doing the research. And I strongly encourage you guys to do the research before you do anything like this. I know I was looking up all these videos and doing my research about the whole procedure. You want to be knowledgeable about this as much as you can. You definitely do not want to go into something as permanent and serious like plastic surgery like that unless you really know what you're doing and what you're getting into. You'll see in the video I ask him questions because I want to know directly from a plastic surgeon who's trained in this what he knows and what he can do as or do for me, I should say. I know that every plastic surgeon is different, even though they're trained the same, but their approach to a procedure and their work is different than everybody else's. Their approach and their opinions, their medical opinions are different from every plastic surgeon. They're like an artist. They have to see their canvas, so it's important to see the plastic surgeon in person for a consultation so he knows what he's gonna work with and you know what you're getting yourself into. I did want to mention I made a video saying that I don't trust doctors at all. Definitely check that video. I'll link it down below. I basically want to address, since I am seeing a doctor in this video, that in that video I was basically explaining why I don't trust doctors, because I believe that you are your own doctor. When it comes to your health, I am seeing a plastic surgeon. He is a doctor, but you know, I believe that there are doctors out there, not good doctors out there, that just want to do something solely for your money. So it's important to find a really good doctor that you trust, and definitely see multiple doctors, of course. But when it comes to your health, I believe that, you know, eating right, exercising, and all that stuff comes to play in boosting your immune system and carrying yourself through your life. Doctors are kind of like the last resort. You definitely don't want to see one because, you know, they're not God and they can't always save you. And sometimes they don't even care about you and they just want to do something that's not in your best interest. You want to find a doctor that puts your interest before theirs. Oh my gosh, I talked so much already in this video, I'm sorry guys, but I'm going to roll the clip now. Enjoy. So I'm interested in the whole breast augmentation with the fat transfer because I'm interested in something that's more natural, not, you know,
okay,
fake, I guess.
yeah. I mean, there's a few options for that. If you have fat, you know, stores in your hips, in your stomach, thighs, if we can find enough fat, we can, you know, take it and we take it out with liposuction, which is using a small little tube, and then we process the fat, and then we can re-inject it where you need it. The problem that we have with that is most, you know, a lot of people who want this procedure don't have enough fat. There is a few other options. And some of them involve using a suture that kind of goes around and kind of recruits tissue if you have loose abdominal skin. That's kind of a newer technique. The other thing to consider is prior to putting fat, sometimes we have people use something that expands the tissue called, the old device was called a Brava device, and it kind of suctions and it kind of stretches the skin, so then when we transfer the fat, there's less pressure on it. So if you want to, you know, stop filming for a minute, we can do a little exam.
Before we stop, I just wanted to talk more and ask more about it. So, like, how much fat would you say you're doing?
I mean, I think to make a difference, you would want to be able to inject at least, I mean, a small fat transfer would be 100 cc's, a larger one maybe 300 cc's, but you don't want to put too much at a time, otherwise it may not all survive, and then you can get little firm lumps and things. Okay. So you want to do, you know, your body can only accept a certain amount of fat at a time.
So in that case, would you have to see me more often?
It's possible to do, you know, more than one transfer. Like some people, we take fat and then we transfer it and then they come back for a second session. That's possible.
Okay. So. And then there are like small incision. Is it kind of like a BBL, like where you take a needle and inject fat?
Yes. For this one, you know, the incisions are only a few millimeters, and sometimes they're only as big in certain areas as just a large needle. So those heal very well. You don't see them.
So no, it's not that much scarring.
No.
Okay.
The liposuction incisions are about 5 millimeters, and those it's from where we take the fat. But the ones where we inject it are even smaller.
Okay. And then as far as like shape goes, like, would you say, like, would you recommend this more to someone who wants more shape or just like just more?
I mean, I think implants give a little bit better shape,
right?
Because it kind of shapes the upper pole here. You can get some of that shape with fat, but you know, I think for shape-wise, implant gives a little more structure, a little more shape versus fat.
Is it like when a woman is to like wear like maybe push-up bra, does it have? Can you provide cleavage? Like, do you think it
with fat alone?
Yeah.
It depends. It's possible, but it kind of depends what your skin and what your tissues are like to start with. If they're a little bit looser, then that kind of tells me there might be some more room for expansion with the fat. If it's tighter skins, it's a little bit harder to get a big change.
Okay. And one more question. Is the fat in your chest and the woman's breast different than the fat around?
Yes. I mean, you probably only have a very small layer of fat because you're thin over your breast, and then you have breast tissue that is different than the fat.
Oh, okay. Got it.
Yeah.
Okay.
Yeah.
That's all the questions. Okay. You just like film it sideways so that way like nobody
Or
can
I
see
could,
me.
I mean, I guess.
So you just go like
go ahead.
this.
No, I go
No,
ahead.
just like film it this way. That way, if I open it up, nobody can see me. It's
There you
okay.
go. Okay, have a seat here.
Okay.
All right, so I'm gonna take some measurements. So on the right side, Maylin, it's gonna be 19. Left side, say 19. Do you think one side is different than the other, or pretty similar?
I think it's pretty.
I think pretty similar.
Yeah.
Breast width, say 10.5 on the right, say 10.5 on the left. Fold to nipple, say 6. Fold to nipple, say 6.5. You know, you do have some
I want
shape.
to have. I like the shape, obviously, but I just want more of it. You know.
So, I'm feeling you do. I mean, it will stretch some, so they're not so tight. So that's a good thing. I don't have you stand up. And then here,
I just want fat mainly. I think the only area is my belly. Like I have back fat. I would like to be like perfectly flat. That we will.
let's see, turn that way. Yeah, you do have a little fat there. And then turn around this way. This is where a lot of fat hides.
Yeah, I do have left
So, you know, just a little. You have a little bit there. It's not bad.
Okay.
What about her legs and arms?
I like the legs.
Yeah, don't. I mean, yeah, don't.
Just
Yeah.
going, I have some of my arms.
I wouldn't like. I wouldn't. Let me see. Not necessarily, but if you know, let's see. You may be able to find a little bit, not much, but it's you know it's a trade-off. You know, because you're thin, you have a little bit more risk of causing a contour abnormality from lipo. Like a little indentation might show up more.
Okay.
So I mean, especially if we're really trying to get fat. So that's something to consider. I mean, your skin is very good. There's no stretch marks. So you know, in that sense, you are a good candidate for lipo. I think your skin will contract.
Okay.
But you know, the only place where I saw like we could get a little bit is just the belly.
Yeah.
So I'm just kind of like, let me see one more time. Is it worth? Would it be enough? Would I get enough to make it worth it? Flex your abs. It's really not a whole lot.
Okay.
So it's
Or
like,
maybe a little bit from my legs.
I mean, that is not much either. There's only a little bit there.
What if you like were to take a little bit from my whole body? Yeah, leave it.
I mean, that's what people do. I mean, that's what people.
Mainly my belly though.
Yeah.
I would like, and feeling.
How about you eat some more and then?
Well, that's the other thing. I mean, if you could, you could gain some weight. We could take fat and then put it, and then even if you lost weight, you'd still have more on your breast.
That's what I was thinking
yeah.
too.
So that's possible.
She said,
So,
no problem.
yeah, I mean, we can do that. So, but I mean, the other alternative is like a small implant. In that case, you don't risk liposuction anywhere. If you wanted me to take a little fat from your belly, I could, and do both to kind of make that's like a combined approach. So you can make the implant look a little bit more natural by putting a little fat. Yeah.
Do you have retractable implants?
No, retractable.
Yeah.
No. Like where you can.
It's like it's a silicone, but it's like encapped into, so it's very similar to human breast.
No, I mean
They call retractable.
I use just cohesive gel implant, so it's like gummy bear implant. That's my preference, but yeah.
Is that the new thing?
It's not that new, but it's relatively new.
But it's silicone, isn't that gel that's really bad if it ruptures? It breaks?
Now it's if if it ruptures, it stays like as one, like a gummy bear. The old silicone was very thin, and when it ruptured, there was a big problem. I've taken care of those patients, and it can be a real mess with the leakage that's inside. So, yeah.
I think.
Yeah.
How long does the healing process take?
You know, from
walk around the next day?
From lipo, yeah, you can walk around. You know, really we just would keep pressure off the breast because you don't want anything to hurt the fat.
Okay.
Yeah.
What about the sedation? Does it need to?
It does probably need general with, or at least some IV sedation would be best.
She prefers like she
I
doesn't
mean,
want to.
I could do a small. I can't do breast implants awake. I can do. I could do a small amount of fat transfer awake. That's possible.
I mean the sedation,
Under local,
local,
yeah.
not local like what
Yeah.
I had. It's sedation, like she had extraction with some teeth extraction.
Yeah, just a little IV.
Yeah.
Yeah.
And for my case, like how much, like what is the size would yield?
So like in your case, I'm not that excited about doing just fat transfer because it just won't be. It'll be very subtle, and I think you'll be like. I mean, I think a small implant with maybe a little fat too could be good, or just a small implant would give you. I mean, like this. Just looking at you, you don't have much fat on you, so it's like you know, I kind of
She still have a little bit than me.
a little bit more than you, but such a small amount, baby fat.
Yeah, I told her it's not enough fat.
No, I think it would be like you'd be kind of like, this is it.
She would be like a -8 going to an A.
Yeah,
Probably.
yeah.
Okay.
Yeah, but I mean, yeah, that's kind of. I mean, yeah, you're young.
For even if you were to take parts fats all over my body, it would still
Be still not that good. I can show you something.
Okay.
Have you have case?
Let me
That's
see
the
one
case.
thing.
Okay.
There's something with this suture. I can show you videos that I went to the class to learn it, but it goes from here. Actually, can mom look?
That's gonna be it for this video, guys. I hope you liked it. If you did, give it a big thumbs up. Subscribe down below if you're interested in more of my videos. If you like my content already, subscribe. If you want to, comment down below if you have any questions for me. If you have any questions for the plastic surgeon I saw, Dr. Ivy, I'll link his Instagram down below. You can definitely DM him. I hope this video helps anybody out there that was curious or that is curious about this whole breast augmentation but with fat transfer procedure, and I hope this adds to your research. Please do your research before you do anything like this. I hope this feeds your curiosity, and yeah, that's it. I'll see you in the next video. Bye.